Hi, this is Thalia MK at Conference Health 2.0 Dubai Winter 2022, and I have with me Mr. Neelesh Shinde, who is from Group CTO Jupiter Hospital Dubai, sorry, India, and he also received an award, I believe, for outstanding leadership. Congratulations to you and to your company and your amazing leadership skills. Please tell us about you and your company a little bit.
So myself, Neelesh Shinde, uh, Group CTO, Jupiter Hospital, India. My company, Jupiter, is a chain of tertiary care hospital, and we serve on ideology of patient first from since last 15 years. And as far as me concerned, I've started my career in healthcare industry somewhere around 1997 through company called as Elsin Israel. Then I was part of G Medical Systems. During that my tenure, I did lot of installation of CT scanners, almost 50 CT scanner I have installed, then 10 MRI scanners I have installed. But I always realized that in medical field there are a lot of things to be done with the hospital industry. And if I want to do with hospital industry, it is like service to mankind is service to God, and it is always like you need to take some bold decisions. So life is all about taking choices and make sure that whatever choices has been done by you, accept it and move ahead. So similarly, I'm talking about 2004. After having experience of 9 years into healthcare industry, then I thought to join hospital industry, and in 2004 I joined there as a biomedical engineer and project coordinator. And it is a proud moment as a biomedical engineer because this is a unique example in healthcare industry where the biomedical engineer is the first member of any of the hospital group. So I started my career under the guidance of Dr. Ajay Thakkar, who is the chairman and MD of that group. And during last 19 years, I did lot of installations, projects. And when I'm doing the projects and all, the lot of leadership skills has come into me. Thank you.
Amazing, amazing. That's a lot of work put into one field and one mission. As you mentioned before, you are also building a specialized greenfield hospital, an energy efficient hospital. When you talk about energy efficient, it's very quite obvious that it's about saving energy and providing best services. What do you mean by greenfield hospital?
Okay, so since last 19 years, I am doing a lot of hospitals. And first hospital, what we started in 2007 at our Thane, that is Jupiter Hospital Thane. We were most expert into medical equipment. So while designing, we make sure that we have a lot of medical equipment, latest technology which was available in 2007, and along with that, patient comfort. But then after 5 years of operation, we realized that we are losing lot of things on the energy because our electrical consumption was too high. And then we thought about next project, whatever we'll do, we need to look into that energy efficient measures. And from 2014 onwards, we have started thinking about new project and energy efficient measures which we need to use for the hospital. And from 2014 we have done a lot of energy efficient project. Then we have a tie-up with Indo-Swiss BIP, and that they have developed one hospital that is called a Jupiter Hospital, and which had made a huge impact as far as energy efficiency has been considered. And this hospital has been awarded for the Ministry of Power for the best energy efficient hospital this year. And what are things we have done? We have done some small things there, and which has made a difference. That our rooftop has done additional XPS insulation for 4 inch, and then our glasses, what we have used, glasses which can be useful for patient also, but at same time is double glass units, so that the U value has come down. So definitely along with that, instead of brick wall, we have used AAC block, then free cooling, enthalpy wheel. All these measures we have done, and we are able to do energy efficient hospital. Similarly, during the projects, I have observed that when we are doing a lot of projects in timely manner, like some of the projects which I would like to tell you that I've done one project where the operation theatre, which was developed and created robotic operation theatre in 168 hours non-stop work. So believe me, 7 days non-stop work, and we have done that. Similarly, the fastest cath labs installation has become record in Southeast Asia. Then there was one thing what we have done is that neuro rehab. There are a lot of technologies like robotic, then virtual reality has been installed there in our hospital. And similarly, during COVID was always a challenging for everyone. And during COVID, like I was always there on the field. And if you know that in India, there are a lot of requirement for the hospital beds during COVID. And the first hospital which are done on the field, and I had a very small contribution, big contribution I can say in that, where we have developed 1,000 bed hospital in mere 3 weeks. So these are the things what we have done in projects. And when I'm doing with so much of experience into projects, I made my own definition which you will not find anywhere in the Google also. So project for me, definition is P stands for positive thinking, R stands for rapid action, O stands for one team concept, J stands for judgmental approach, E stands for effective communication, C stands for chase to achieve goal, and T stands for timeline management. Thanks a lot.
Thank you so much for your time. And I would like to know, your services are available in India. You are now not only helping hospitals or clients or patients, but you're also helping the environment by doing so. Are these services or this knowledge of yours is available for outside India, outside Jupiter Hospital? And are you guys planning to expand your hospital to over here in Middle East or outside?
Like making hospital building is different, but running that as a patient oriented hospital is somewhat difficult. So I'm not saying that we will expand into other areas, but yes, like if you require something, some expertise from us, some valuable guidance from us, we are always available. I'm always available on LinkedIn. My numbers will be available on LinkedIn, so they can contact us and whatever information, because these are the events like Healthcare 2.0 is an event where all technology leaders has to understand that they are always in learning phase. I am also learning a lot of things here. I am learning about artificial intelligence, then green hospital. So this is a place where everything is getting, ideas are getting exchanged, and we are communicating with so many leaders. And this is very, very important if you want to grow as a leader. Thank you.
Thank you so much. Congratulations on your award. Congratulations for thinking out of the box and helping environment, indirectly the world, so that I hope people learn from your hospital how to save energy, how to provide back to not only patients, help them, but also save the world as well, save the earth as well. And on that note, I would also add on, please avoid using plastic as much as possible. I know our lives is full of it, but plastic usage is very difficult because the disposal of plastic is very impossible to happen. So avoid plastic, use less water, and be kind to each other. Help as much as you can. This is Talia MK signing off. Thank you.